Knock, knock, knock. Hello, my name is Tyler. I'm going to be your nurse today. Can I get you to verify your name and date of birth? Hector Ochoa, 1/1/1980. Perfect. Mr. Ochoa, do you have any allergies? No? Okay. Mr. Ochoa, like I said, my name's Tyler. I'm going to be your nurse today. I'm going to be doing your head to toe assessment. Okay, what that entails is exactly what's in the name. Is I'm going to be looking from head to toe, making sure that there are no abnormalities or anything that needs to be communicated to the provider. So if at any time you feel uncomfortable or anything like that, it is going to be a painless procedure. But if you feel uncomfortable at any time, please let me know. Okay. All right. So first, I'm going to raise your bed, get your side rails. Mr. Ochoa, do you need to use the restroom before we begin? No? Okay. And are you having any pain? No? Okay, good. All right. Mr. Ochoa, could you tell me where we are right now? We are in the hospital. Perfect. So you already told me who you are. You know where we're at. Can you tell me what day of the week it is? It's Wednesday. Great. And can you tell me why you're here? I'm here for some routine tests. Great. All right, so I'm just going to raise your bed to working height, provided for privacy, and provided safety. Okay. All right, I'm going to sit you up. And first, I'm going to begin with your head. And what I'm going to be assessing is your eyes, your nose, your mouth, and your ears, as well as your scalp. Okay. All right. So I'm going to go ahead and I'm going to dim the light so I can assess your pupil reaction. Okay, so I would dim the lights, have you open your eyes, go to the side, okay, going under. What I'm assessing for is to see if your pupils are reactive to light, which they were. Okay, I'm going to turn on my lights again, and I'm going to be looking to see if your pupils are equal, which I'm looking at the pupils. They are both equal in size, they're both round, and they're both reactive to lights, as well as I'm going to test your accommodation. So what I'm going to have you do is I'm going to have you follow this pin light. Just keep your head still and only move your eyes to follow the pin. To the side, over here, up, down. Good. So I have perla, which means that your pupils are equal, round, and reactive to light. So I'm assessing your scalp, making sure that there's no wounds, there's no issues that I would need to communicate to the provider. I'm going to go ahead and assess your nose. What I'm looking for is I want to see if they are both nostrils are patent. Are you having any trouble breathing out one of the sides of your nares? No? Okay. All right, so then I'm just going to look myself, looking up there, looking, seeing if there's any drainage, if there's any discoloration, if there's an increase in secretions in there as well. Okay, I'm going to assess your ears. I'm only assessing the external side of your ears. I'm looking at the skin. I'm looking to see if there's any drainage, any redness, any discharge. Look at that ear. If you can turn your head towards me. And Mr. Ochoa, do you have any issues hearing? No? Okay, so you don't wear any hearing aids, anything like that, or hearing concerns that I should be aware about? Nope. Okay. All right, next I'm going to look in your mouth. If you can just go ah for me, I'm going to be looking in your mouth to see, making sure that your uvula is in line, making sure that I'm assessing your gums, making sure that they're pink, moist, and intact. I'm also going to be looking at your teeth to make sure there's no discoloration, there's no broken teeth. You don't wear dentures, do you? No? Okay. And I'm going to be assessing your tongue. What I'm looking for in your tongue, that it's pink, it's moist, as well as it's intact. There's no fissures or anything that would indicate dehydration. As well as I'm looking at your lips, making sure there's no cracks, there's no issues with those. Okay. So, Mr. Ochoa, what I'm going to do next is I'm going to assess the symmetry of your face, and what I'm going to do is I'm going to have you smile, and I'm just going to make sure that both sides of your face are symmetrical. If they weren't symmetrical, that could be a sign of a stroke or Bell's palsy, and that would need to be communicated to the provider. Okay, but I'm looking and I don't see anything abnormal. Face is symmetrical. I'm not seeing any oxygen that the patient is wearing. If I did, I would make sure I would be checking the amount of liters of oxygen that they're receiving, as well as if it's a nasal cannula, if it's damaging the skin on the back of their ears. Okay. So now that I'm done with the head, I'm going to move on to the neck. With the neck, I'm going to be assessing first their carotid pulse. I'm going to go ahead and do the carotid pulse on the left side first. I'm measuring for the rate, amplitude, and the rhythm. That is a +2 amplitude, so it is normal. And on the right side, say that I got a amplitude of +1. That would mean that it was weak and that it's different from the other side, and I would need to communicate that with the provider. Okay, so I'm assessing the carotid pulses. Now I'm going to be assessing your jugular vein. So if I can have you turn your head to the left, making sure I'm checking for any jugular vein distension when they're sitting up. Looking at that side, looking at this side, it is negative on both sides. I'm looking at the back of your neck if possible to see if there's any wounds, any concerns, making sure that your trachea is midline. Okay. Now that I'm done with the neck, I don't see any tracheostomy, so I can go ahead and move on. Mr. Ochoa, for this next part, I'm just going to unbutton your gown a little bit. I'm going to be assessing your skin turgor, and how I'm going to do that is I'm going to pinch some skin right over your clavicle, pinch it up to see if it tense. If it tense, that can indicate dehydration, but if it rebounds fairly quickly within 3 seconds, that means you're adequately hydrated. So both sides, you're good. Okay, I'm just checking the skin around your neck, your upper chest, making sure there's no discolorations or anything that I should be concerned about. Okay, so next, what I'm going to do, Mr. Ochoa, is I'm going to listen to your anterior breath sounds. Now, for real patients, you're not going to take their gown off completely to do this, but the best way to hear lung sounds is going to be skin to stethoscope, making sure you don't have any clothes in between your stethoscope and the lung sounds. Okay. Put that in. Mr. Ochoa, I'm just going to have you breathe normally, okay? So I'm going to start with one, two, two, three, three, four, four, five, five. Okay, so lung sounds are clear bilaterally. I don't hear any diminished lung sounds. I don't hear any crackles or rhonchi. Okay. Next, what I'm going to do is I'm going to listen to your apical pulse, Mr. Ochoa. So what I'm going to do is I'm going to make sure I'm on the left side of your sternum. I'm in the fifth intercostal space. And so that's going to be right over the apex of your heart. I'm going to listen for a full minute to get your heart rate. Okay. So I'm getting the apical pulse. I've listened for a full minute using my watch. Okay. I've gotten a reading of 76 beats per minute. Okay. All right. So what I'm going to do next, before I turn you on your side, Mr. Ochoa, I'm going to go ahead and assess your abdomen. Okay, so I'm just going to button you up. Just going to move your gown to the side just like this so I can assess your abdomen, making sure I'm not seeing any stomas, any ostomies, anything like that, any wounds. Seeing to make sure that if your abdomen is distended. Are you having any abdominal pain? No? Okay, good. All right. So what I'm going to do is I'm going to auscultate, which means I'm going to listen to your bowel sounds first using my stethoscope. Start with right lower quadrant. Hear the gurgling sound. Listening to right upper. Hear the gurgling. Left upper. Hear the gurgling. And left lower. Hear the gurgling. And so what I'm listening for is make sure the bowel sounds are active. They're not hypoactive or hyperactive. Okay, I'm not hearing any high-pitched tinkling noises that can indicate a bowel obstruction. So what I'm going to do next is, since you stated that you don't have any abdominal pain, I'm going to palpate your abdomen just to make sure that you don't have any tenderness. So at any time you have pain, please let me know. So I'm palpating gently. I'm watching my patient's facial expressions, making sure that if they're showing any grimacing, that I'm asking about that. But let's say that the patient stated that they had no pain there. Okay. While I'm here, Mr. Ochoa, are you having any issues voiding or having a bowel movement? Okay. I would be assessing to make sure that there's no Foley catheter. If there was a Foley catheter, I'd be making sure I'm checking how often it's getting cleaned. I would make sure that I'm looking at the tubing, making sure there's no kinks, that the tubes are not having a dependent loop, and the bag is below the bladder to where it's able to drain by gravity into the bag. Okay. Are you having any issues with bowel movement? Say patient did not. When was the last time you had a bowel movement? Last night. Okay. Can you describe, was it difficult to pass or was it soft? He had no issues. There were no issues. Okay, good. So what I'm going to do now, Mr. Ochoa, is I'm going to listen to your posterior lung sounds, but what I'm going to have you do is I'm going to lie the bed flat. And I'm going to turn you on your side. Are you able to assist me in laying on your side? Yes. Okay, perfect. If they were not able to, this is when you would need a assistant to help you get them on their side. Okay. Go ahead, making sure that my side rail is up on the other side. Okay, turning them on their side. Okay, while I'm back here, I'm assessing for their skin. I'm assessing if there's any wounds, mainly checking or especially checking over the coccyx, making sure the pressure points, there's no sores or redness that is beginning to form. Okay, so I'm going to have you hold that bar right there, Mr. Ochoa. Okay, so I'm going to start with at the top part, 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 7, 8, 9. Okay. All right. Assess back here and make sure that there's no wounds. If there's any dressings back here, this would be a great opportunity for me to take them off and look at the wound. Okay. So I'm going to go ahead and lay you back down. All right. Okay, so now what I'm going to do, Mr. Ochoa, is I'm going to sit you back up and I'm going to be assessing your arms. So first I'm going to be assessing, are you having any numbness or tingling in your arms? No. Any pain? Nope. Okay, good. What I'm going to assess first is going to be your peripheral pulses, which are going to be your radial pulses. I'm measuring the rate, amplitude, and rhythm, so they're regular. Bilateral 2+ amplitude, so that is normal. I'm going to be assessing for your capillary refill, which I'm just pinching the nail beds. They're both less than 3 seconds. Okay, and can you give my hands a good squeeze with your hands? Squeeze, squeeze, squeeze. Good. Strength is good. All right. Mr. Ochoa, are you able to raise your arms yourself or do you need assistance? Let's pretend that the patient needed assistance. If they didn't, I would have them do active range of motion and they could do this themselves. But let's say that the patient needs me to do it. I'm going to have them go hand to shoulder as much as possible. Have them go out to the side. I never want to force their arms to go more if they're complaining of pain or if they're very stiff joints. Okay. Pull my rail, come over to the other side. Making sure that I get both sides. Okay. For the side, hand to shoulder, hand to shoulder. Okay. All right. Make sure I have my side rail up. I'm going to go back over here. Or actually, you could stay on this side if you wanted to, but I'm just going to come back over here so you can see me better. Okay. So I've done the upper extremities. I'm going to go to the lower extremities. So I'm looking at their leg, making sure there's no wounds. There's no lines that I need to be aware of. Okay. Assessing this one as well. Now I'm going to assess the pedal pulse. How you do that is you place 2 fingers over the pedal pulse or the pedal artery right here. I feel that there is 2+ amplitude. The rate is good and the rhythm is normal. Okay. How I'm going to test your strength in your feet is I'm going to have you're going to plantar flex, just like you're pressing a gas pedal against my hands. Press, press, press. Good. Now I'm going to have you dorsiflex, and that's where you're going to pull your nose to your toes to your nose. Okay, pull, and you're pushing against their hand as they're pushing against you. Okay. All right. Now I'm going to check your capillary refill. They're both less than 3 seconds, which is normal. Now I'm going to have you move your leg up and down to do some range of motion. If they're unable to do active range of motion, you would need to do passive and help them out. To the side, maybe even some more knee bends. Okay. Coming over to this side. Okay. Knee bends. Knee bends. Is that hurting at all, Mr. Ochoa? No? Okay, good. All right. I'm finishing up and making sure that I'm documenting anything that was abnormal, any lines, any wounds, any abnormalities that the provider would want to hear about. Okay? I'll be documenting everything I observed. Mr. Ochoa, are you having any pain? Do you need to go to the restroom? Nope, I'm good. All right, well, I'm going to make sure that I lower your bed to the lowest position. I'm going to make sure I give you your call light and make sure that your belongings are within reach. And then I will go outside the room once I have doffed my gloves, performed hand hygiene, and document my findings. Okay?